Hello everyone, this is a short video on Castellvi classification of lumbosacral transitional vertebrae. Lumbosacral transitional vertebrae are a relatively common variants, and identification of them is essential in order to avoid an intervention or surgery at an incorrect level, and also there can be a low back ache associated with them. So here is a coronal T1 weighted image of a normal sacroiliac joint without a lumbosacral transitional vertebra. So these are the transverse processes and these are the sacral ala. In type 1, there is enlarged and dysplastic transverse process which is at least 19 mm in height, that is in craniocaudal length. If it is unilateral, it is type 1A, and if it is bilateral, it is type 1B. In type 2, there is much more enlargement of the transverse process forming pseudoarticulation with the sacrum. Also, there is incomplete lumbarization or sacralization seen. If it is unilateral, it is type 2A, and if it is bilateral, it is type 2B. Also, if in these patients there is associated low back ache seen, this condition is called Bertolotti syndrome, which is seen in subtype 2A and 4. The cause of pain is attributed to lack of symmetry in these types of vertebrae. In type 3, there is enlarged transverse process along with complete fusion with the sacrum, as we can see here. The enlarged transverse process fusing completely with the sacrum. If it is unilateral, it is type 3A, and if it is bilateral, it is type 3B. In type 4, there is type 2A on one side and type 3A on the other side. So, to summarize, these are the normal transverse processes and sacrum. Here, there is enlarged transverse process on one side, so it is type 1A, whereas it is enlarged on both the sides, so it is type 1B. Here, there is pseudoarticulation of the transverse process with the sacrum on one side, so it is type 2A, whereas it is on both the sides, so it is type 2B. Here, there is complete fusion of the transverse process with the sacrum on one side, so it is type 3A, whereas it is on both the sides, so it is type 3B. Here we can see subtype 2A on one side and subtype 3A on the other side, so it is type 4. Thank you.